Stem cell therapy is still years away for you and me, but for our pets, this modern medical procedure is now available. And Dr. Veronica Bingaman is an associate at ABQ Pet Care, Hospital, and joins us with more information. Good morning.
Good morning.
And
Good
I
to
see
be
you're
here.
not alone.
No, I got Brandy here. She'll be on later on for Pet of the Week, but she's a 5-year-old Chiweenie.
Oh, sweet
So,
little
yes.
girl. Well, let's go ahead and start talking about what is stem cell regenerative therapy.
You know, it's an innovative medicine. It's a broad term, and what that means is for the body just to regenerate itself. Now, with stem cell therapy, what that is we actually, in pets, we take stem cells from their fat. And what those stem cells are, they're immature cells, so they haven't determined if they're a bone cell or a liver cell. And what we do is we take those immature cells and we put them in places that are diseased or inflamed, and then they turn into those cells, and so they can help the patient get better.
And they can regenerate. That's fantastic.
Yes.
Now, what diseases can this therapy treat?
Well, the most ones that we use in veterinary medicine is for arthritis.
Okay.
It's for dogs and cats, and it's also used in horses, but for our sake, for dogs and cats. But there are some research out there that they're trying to look into, maybe kidney disease and autoimmune diseases. But right now we're using it mostly for arthritis.
For arthritis, okay.
Yes.
And if we're curious, say we've got pets, because I'm sure that there are a lot of folks out there that do have pets that might have recurring conditions. How do we know if our pets are good candidates for stem cell therapy?
You know, that's a good question. First and foremost, you know, do they have arthritis? And also, are they on other medications? Maybe they've been on an anti-inflammatory medication for a long time, or glucosamine, and they're doing well, but they're not responding as well as they used to.
Right.
Stem cell therapy may be the next thing for them to kind of add to their therapy to make them feel better.
Okay, well that's good to know. If other options are not working, then we take it to the next level.
Yes,
Great. Okay.
yes.
Well, so not to get terribly graphic, but I am curious. How do you collect the stem cells?
You know, it's a 3-day process. Day one, what we have to do is they have a small surgery. What we do is we make a small incision, and there's a fat right in front of the liver called the falciform fat.
Okay.
What we do is we get in the abdomen, take out that fat. They go home that day. That night we send it off to the lab. They extract the stem cells from the fat, and then on the 3rd day we bring the patient back, and then we inject it either directly into their joints, such as their hip joints or their knees, or we can do it in their blood, and then the cells just go to areas. There's almost like a signal where they need to be for healing.
Wow. Okay. So they just instantly start responding to it.
Correct.
That's
yes,
amazing.
Yes.
So they come back. They do it. What is the process of healing? How does that process work?
So first and foremost, we want to reduce inflammation and pain.
Okay.
Secondly, we want to restore their quality of life and also alleviate any pain. And thirdly, we want to regenerate joint tissue, cartilage, things like that, and ultimately relieve arthritis.
Right. And how long does it typically take before we start seeing improvements?
You know, some patients, they see it right away, but it could take up to a couple of months.
Okay.
So it just depends on how their body responds to everything.
And do little dogs respond better, big dogs, or is it just kind of?
You know, we usually do it in big dogs, and it just depends on their own body how they respond. Kind of with anything with medicine, it just how their body's going to ultimately receive those cells. But the good thing is, because it's their own body, they receive it, they don't reject it like some other, you know, outside, another donor or something.
Right. So do you have any success stories with this treatment?
Absolutely. We've seen dogs with a hip dysplasia, so hip arthritis. We can inject the cells right into there, and we've seen dogs that have been lame, limping, that they start to walk a lot better.
Oh, that's fantastic.
Yes,
well, I know you know a lot of big, like German Shepherds and dogs like that, they suffer from this dysplasia. So that's good to know. Well, for pet moms and dads, how can they get a hold of you?
Well, give us a call at ABQ Pet Care. That's 299-8387. You do have to have credentials to do stem cell therapy, and that's something that our doctors do have. So give us a call or check us out at abqpetcarehospital.com.
Fantastic. All right. Well, Brandy, so good to meet you, sweet girl. Like the Chewbacca jacket.
Yes, got to get her home.
That's right. Thank you so
Thank
much.
you.
All right.